Good afternoon and welcome. My name is Aneta and I am part of the events team at Hornsby Library. Council recognises the traditional owners of the lands of Hornsby Shire, the Darug and Garango peoples, and pays respect to their ancestors and elders, past and present, and to their heritage. We acknowledge and uphold their intrinsic connections and continuing relationships to country. Our health information session today is on multiple sclerosis, and with us is Nicola Graham. Nicola is a health educator with 2 decades of experience. She's also the Education and Wellbeing Co-Ordinator for Multiple Sclerosis Limited, looking after education for both people with multiple sclerosis and health professionals. She has degrees in engineering and health science. She tutors medical students at Monash University, is on the board for the Cancer Foundation, and developed the Eat Well, Live Well Interactive Nutrition Guide for people with multiple sclerosis. Today, Nicola will present an overview of multiple sclerosis. Welcome, Nicola.
So welcome to today's webinar, which is all about learning about multiple sclerosis, a very general overview. And thank you very much to Hornsby Shire Library for asking us to come and present. So what we're going to cover is what is MS, why does it happen, where does it occur, something about the pathophysiology, about lesions, different types of MS, what are relapses, symptoms, very little bit about treatment. We've got lots more in-depth, deeper dive webinars in the medication areas, and then some top tips for people who are living with MS. So what is MS? It is a chronic demyelinating autoimmune disease of the central nervous system. And I'm just going to close my webcam because I can see some people are having a broadband issue, so that might help for some people. And I'll pop my webcam on again a little bit later. So we'll talk about what that word demyelinating means in a little bit more detail shortly. It is an autoimmune condition, which means that's the body's immune system attacking itself, and it shouldn't do that. So why does it happen? And let's have a look. There's quite a lot of information on this chart here. And a lot of people will be very interested in the incidence of MS. So out of 1,000 people, there's a 3 to 5% chance that you might get MS if you have one parent that's got MS. There's a 12% chance you'll develop MS if you have both parents. That also translates to an 88% chance that you won't have MS, even if both of your parents had MS. And out of 1,000 people, 0.1% or one person in 1,000 on average will go on to develop MS in their lifetime. We've got just statistics people are always interested to know. In Australia, we've got about 25,000 people in Australia with MS. There's about 2.3 million people worldwide with MS, and unfortunately 3/4 of all the people with MS are women, and typically in the age of 16 to 55, although we are getting a higher incidence of pediatric MS, and also when people are diagnosed with MS when they're older, it's often much more progressive. It's not curable currently. Let's hope there's a cure found very soon. It's definitely not contagious. It is a lifelong condition, and as I've mentioned, we don't fully understand the cause. What this chart here is showing is around the distribution of MS, and what we can see, it is considered a condition or a disease of latitude. So the further we get away from the equator, the higher the incidence of MS. So you can see a low risk is yellow and orange, a low risk around the equator, further away, higher risk, red and purple colours. So if we look at Australia, much higher risk in Tasmania, much lower risk in Queensland. Interestingly, if you were born in Tasmania, higher risk. If when a child you move to, let's say, Brisbane, you will get the lower risk conferred with the baseline population in Brisbane. So there's clearly some environmental factor going on. So we know there's a genetic, as we can see by this chart here. We know there's an environmental factor as well. And we know, for example, that if you had an identical twin with MS, so you've got exactly the same genes, and your identical twin got MS, then you've got about a 25 to 30% chance of getting MS as well. So there's other factors to play in addition to genes. So what might they be? We don't have all the answers. Some of it, as you can see, is where you were born. Some of it is about what infections you might have had that might trigger the condition. So we know that EBV, or glandular fever, has a part to play, but most of us have got EBV, most of us have had glandular fever. Even if we might not have experienced the symptoms severely, a lot of us carry that. So there's a lot of things to play. And we also know that if you're overweight, you're more likely to get MS. If you smoke, we know vitamin D and sunlight might play a part. We know that race plays a part too. So Northern Europeans, Caucasians, are more likely to get MS. It's lower incidence in Africans, Indigenous Americans, Indigenous Australians, and lower in Asians. So quite a few things to play. I'm just going to pause. I can see a couple of questions. I just want to check everything's working okay. Oh, okay. So a couple of hands up. Some people couldn't see the slides. Yep, that looks like everybody can see the slides now. Okay, that's great. Terrific. So for those of you who couldn't see the slides then, just indicating here the incidence and percentage risks and the genetic component, and this chart here just indicating the latitude effect. So where does MS occur? Well, it occurs in the brain and in the spinal cord and in the optic nerve, and that's what makes up our central nervous system. Now, a little bit technical here in terms of the actual disease process or the pathophysiology which is going on with MS. So this blue area here in the brain, so this is the brain area. This blue area here is called a neuron, and the neurons are the predominant cells, nerve cells in the brain. This green here is the fatty tissue called the myelin. And then we've got a barrier of tight cells here and our blood here with some immune cells, T cells and B cells. And what happens in MS is that it's an inflammatory demyelinating condition. So we have a gap in the blood-brain barrier, which shouldn't happen, but does in MS. And that allows some immune cells to come through, our T cells and our B cells, to now enter the brain where they shouldn't. They have an effect on the myelin and cause inflammation and demyelination. And this macrophage is part of our immune system that actually eats and engulfs things, and it's engulfing that oligodendrocyte there. So we see then that the myelin is affected in MS. So if you think of this as like an electrical circuit, this is our neuron, and an electrical signal passes down what we call an axon here. Electrical signals travel much more effectively when we've got a really healthy, beautiful myelin sheath around it, like the plastic insulation on a piece of wire. And in MS, that insulation, that myelin, is being degraded, is being demyelinated, and it means that that electrical signal doesn't pass as quickly and as easily along that axon, along that neural pathway. Okay, that electrical signal, another word for that is the action potential. And we talk about MS lesions, okay, and a lesion is an area where myelin has been lost, where there's what we might call a plaque or a lesion occurs. And multiple sclerosis, multiple obviously means many, and sclerosis means scars. So we're meaning many scars. So the word lesion is used to describe an area of damage. And we can see here a brain with, and this is on an MRI, and we've got some lesions here, as you can see, pointed out by these arrows. And we've also got, this is the spinal cord, and you can see here that we've got some lesions in the spinal cord. Now, generally, the symptoms of MS do correspond to the areas of the brain or the spinal cord where there is a lesion. And an MRI can help us to differentiate between active and non-active lesions. Sometimes the lesions do repair themselves, so they might not show up again on newer scans. Sometimes the lesions are permanent. Not all lesions are MS related. Sometimes they might be the result of migraine, for example, or stroke or general aging. We also use an MRI for monitoring brain atrophy or brain shrinkage. Now, sadly, brain atrophy is normal for all of us. Once we get over the age of 25, then the brain starts to shrink, just slowly. And in MS, this can happen a little bit faster than in the general population. So we really promote early diagnosis, and then that can allow for timely treatment. And you can also implement a brain healthy lifestyle, which we'll talk a little bit about how you can live well with MS. So the diagnostic process is varied. It will always include a medical history. It can, obviously, when somebody gets diagnosed with MS, it's a different response for everybody, but it's obviously often quite a shock for people to be diagnosed. And the diagnosis can be quite a long process, and often people look back and realise they may have had MS for a considerable amount of time before they actually get diagnosed. The diagnosis will also include a neurological examination. So that would, for example, check your movement, check your coordination, your vision, your balance, your reflexes, for example. And as I mentioned, you may have an MRI scan, or most people will need an MRI scan to be diagnosed with MS. Blood tests cannot diagnose MS, but they are used to rule out other things. You may also have a lumbar puncture where a small amount of fluid, the cerebrospinal fluid, is extracted, and they're looking for, the lab will look at that fluid, and it's looking for something called oligoclonal bands, which we saw in that previous slide. If I just go back, that might be considered an oligoclonal band. And evoked potential tests, that's where we are measuring the time that it takes for signals to travel from the brain. Let's say you wanted to move your hand down to your hand, and in a person with MS, that will be most likely slower. Okay, so I'm just going to pause. Any questions for anybody? Okay. All right. And then Netta, please feel free to interrupt and ask questions at any time. So there are different types of MS, and currently this is how we have them categorized. I'm sure as we understand more, this will probably change, but this is how we're categorizing it currently. So most people with MS have a type called relapsing remitting MS. So about 85% of people with MS have relapsing remitting. And this is time on this axis, and this is disability or disease progression on this axis here, on the y-axis. So you can see that with relapsing remitting, over time, there are episodes of symptoms getting much worse, and then the symptoms will recuperate, and then there'll be a period of stability, and then there'll be another relapse, and then there'll be some recovery from that relapse, and another plateau, and then another relapse. Now the time between relapses will vary for everybody, and for some people it will be years, and for some people it will be more than that, a number of relapses per year. Some people will have very good recovery after a relapse, and for other people it will be significantly life-changing. So MS really is different for everybody. With secondary progressive MS, this often occurs around 15 years, and again very approximately, after somebody has been diagnosed with relapsing remitting. So they have a relapsing remitting type of MS, and then it changes into a progressive, where the condition gradually worsens over time. And then with primary progressive, some people that are diagnosed with MS will never have clearly defined relapses. This is about 10% of the people who are diagnosed with MS. And so there's a constant pattern of symptoms from the time of diagnosis. There may be times when the symptoms are stable or even improve, but overall the loss of function tends to increase. So this gradient can be quite shallow for some people or quite steep for others, or may vary at different times. Okay. So just to give you a little bit more information about a relapse, because obviously 85% approximately of people with MS have the relapsing remitting type. It's often referred to as different names. People might say an exacerbation or a bout or an attack or a flare-up or an episode, for example. And it's normally defined as a development of new symptoms or a worsening or recurrence of old symptoms temporarily. It's important that we determine that the relapse is not what we call a pseudo exacerbation, i.e. it's not caused by something like an infection or a hot bath or an increase in temperature, for example. So a relapse needs to occur at least 30 days after the previous relapse, otherwise it's possibly just an ongoing initial relapse. They can occur suddenly, can be quite intense, or they can be gradual, with symptoms appearing over a few days or weeks. And as I mentioned previously, the symptoms might be quite mild, or they can be quite severe, with people losing significant function. Okay, so any change that a person might experience should be referred to your neurologist. A neurologist really is the key focal person in a person's team when you have MS. And relapses can be treated. They're treated with steroids generally, which helps the relapse to resolve faster because it reduces the inflammation. But the steroids don't really have much of an effect on the level of recovery. So let's think about what symptoms a person with MS might have. And everybody is different, and these are some of the key symptoms. Fatigue. Most people with MS have fatigue, and most people with MS consider fatigue to be one of the most disabling symptoms that they have. And MS fatigue, rest assured, is significantly different to the fatigue that a person with without MS might experience. So MS fatigue is very much related to the fact that those signals are not traveling down the nerves in an efficient fashion. It's taken a lot more work and energy to get those signals traveling through their body. And the fatigue really is a completely unplugged type of fatigue. People with MS might have optical issues, blurred or double vision. Often there's balance issues. They may have weakness in their arms and legs. So it's generally not a generalized weakness, but a weakness in one or two limbs. They may have sensory changes, which means there may be pins and needles feelings, or sometimes a feeling of burning. Most people with MS have some kind of temperature intolerance. most frequently heat, so they will not tolerate hot showers, hot baths, hot days. Some people have a cold intolerance. Spasticity can occur, so that's quite a painful tightening of muscles. There may be sexual problems. There's often continence problems around bladder and bowel. There may be tremor problems. There's frequently pain. And you can imagine a lot of these affect your sleep, affect your mood. There's often cognitive issues around mood and maybe some behaviour change. People can have problems with their speech and possibly swallowing. Now, everyone's MS is different, as I've mentioned. No two people will have the same range or severity of symptoms, and many of these symptoms are invisible. So I know with the work I do with people with MS, it's very frustrating for them, as people will say, you know, but you look fantastic. You know, they may say, I'm you know, I've got MS, feeling really tired, and people say, but you look great, you look so well. And they're dealing with these conditions that are often invisible. And so it can be very hard for a person with MS to convey what is happening for them effectively to their loved ones and friends, family, employers, etc. So I like to think sometimes as MS as being a bit like an iceberg. So people can only see the tip of the iceberg, and there is so much more going on underneath that people often can't see. So what happens after a person has been diagnosed with MS? Well, first of all, they'll start building a team, and the key person there will be their neurologist. They may go to an MS clinic or an outpatient department. They may be in the private or the public sector. They will be assessed as to what type of MS they have, of the 3 types we've discussed. Their acute symptoms will be addressed, and then treatment options in the long term, so disease modifying treatments, will be determined. And we do know that starting disease modifying therapies sooner rather than later confers a lot more protection in the long term. So it can be quite difficult for a person to start a medication that may be having some side effects when they're feeling very well. And it's knowing the long-term game here around preventing the disease progressing. And then a person with MS will be regularly monitored and reviewed by their neurologist, and that will frequently involve tracking symptoms and having an MRI. So who treats MS? Who's involved? Well, a neurologist is the key person. Having a long-term GP is really important. And by long-term, what I mean is that means you can go and have an appointment and you don't have to say, oh, I've got MS and it's like this, and my last relapse was here and I'm treated using this medication, etc. If you've got a long-term relationship with your GP, then you can quickly start your appointment. For similar reasons, having a pharmacist who knows you and knows your medications can really help. An MS nurse as part of your MS clinic can be a first port of call. And obviously your family, friends and social supports, and that can be a peer support group that we can help you with, is really important. So, you know, that's people who may be able to help you in times of a relapse, who understand what's going on for you, who you've been able to communicate what's happening for you really effectively. And then there's an allied health team. So there's a number of different allied health professionals, and what they do. A physiotherapist is quite often quite obvious. They're maintaining function and movement for you as best as possible, maximising your potential. An occupational therapist will come up with strategies to help overcome barriers to completing daily activities, and that might be work. They might help to keep you in work if that's important to you. They might help you with your fatigue. They might help with the driving. They will have strategies to help support memory and cognitive function. So a good OT is gold. A speech pathologist, for some people with MS, swallowing and communication might be problematic at times, and a speech pathologist will help there. A dietitian, it's always helpful. Our nutrition and diet is key to our health. And a podiatrist will look after foot care and anything below the hip, basically. An exercise physiologist will help with specific exercises to strengthen areas and help with balance. And we do know that exercise is one of the most important things that you can do to look after your brain health and your mood and your general well-being. And a psychologist is expert in your mental health and can change the way you think, feel, behave, and react, and can be a wonderful support for you. And then there's the NDIS and MS Employment Support Service, which can help as well. So people build a really effective team around them to help with their MS. Annetta, any questions? How are we going?
Yes, Nicola, I do have a question. It's probably one of the most common ones, but you mentioned that some of the symptoms are vision difficulties and fatigue. In regards to fatigue, when someone is experienced that for quite some time and they just don't pay attention because they're not familiar with the disease, and you just leave it without going to the doctor, can this progress faster if they don't go to a doctor, if it doesn't get addressed straight away? What are the consequences if they leave it for too long? Because look, more or less all of us experience fatigue at some point, and
That's right.
some of us blame work, routine, everyday life. If you don't have any other symptoms, I wonder if this will be against you at some point down the track, if it gets worse.
It's a really good question, Annetta. So most people with MS experience fatigue, and for many of them it's one of the top 3 symptoms that is having a negative impact on their life, as you can imagine. We can't cure fatigue, so there isn't anything that we can do to give more energy at this point in time. However, we can do some fantastic fatigue management strategies, and that's where your OT might be able to help you specifically with some strategies. And we run a program called the Facets program, which is an evidence-based fatigue management program. And people can enroll in that program. It runs regularly. We're running 2 of them, one in the evening and one during the day at the moment, to help people learn how to manage their fatigue. So they really deep dive into what they're doing, how they're doing it, what's important to them, and a lot of cognitive behavioural therapy is part of the fatigue management. So how we're thinking about what we're doing as well. So there's some great management strategies for fatigue, but not a cure. Is it important to get to your doctor quickly? It is important to get onto disease-modifying therapies quickly, because we know that will improve outcomes and slow the disease progression. If a person is having a relapse, for example, so that some symptoms are exacerbating, it's not like having a stroke where the sooner you get treatment, the better and the lower the impact. That isn't the same with MS. It doesn't have to be treated as a medical emergency. However, depending on what's happening in that relapse will depend whether you're happy to wait a couple of days before your neurologist gets back to you, or whether you feel that you need to present at your doctor's or at the emergency department. I hope that helps, Annetta.
Yes, wonderful. Thank you so much, Nicola. Thank you.
Okay, no problem. And to our listeners, please type any questions in your question box, and we will either answer them in the webinar or we'll answer them personally after the webinar. So how do we treat MS? And we do have a lot in the last 10 years, a lot more medications available for treatment, and they may be oral, they may be injected, they may be infused, for example, but we have a lot more treatment options available. So we do, just to clarify some of the language, we have disease modifying therapies that will slow the progression. And then we have symptom management that will minimize symptoms but not have an effect on the disease progression. And then we've got things like a brain healthy lifestyle or general healthy lifestyle options that may help to slow the progression as well. And I think sometimes minimize symptoms too. So I like to think of it in terms of a disease modifying therapy that will slow the disease is a bit like applying your sunblock. You're preventing any further damage, and that symptom management is a bit like more like applying your aloe vera after you've had some sunburn, for example. So let's think about brain health, and I think this is very much common sense, and I'm sure our listeners are very much across this, but there was an international committee that came together, of which Jodie Hartson, one of our executive directors at MS, was a part of that, and it came up with some evidence-based strategies around keeping your brain healthy. And this applies really to everybody, but particularly for people with MS. We really want them to get onto looking after their health and looking after their brain health as early as possible in the diagnosis. So we know, number one, keep as active as you can. We know that higher levels of aerobic fitness are associated with faster information processing and about preserving brain tissue volume, so stopping that atrophy that we spoke about earlier. And when we do particularly high intensity training, so that's high interval intensity training, so short bursts of getting your heart rate up, it releases a brain factor that helps us to grow more brain cells. So there's a certain type of exercise that is particularly useful. So there are other webinars on our website that you can look at specifically about exercising to keep your brain healthy. If you keep your weight under control, that's going to help, because we know that obesity is associated with higher numbers of MS lesions, so being a healthy weight is really important. Keeping your mind active, education, hobbies, creativity can help protect against cognitive problems. So what we're trying to do is keep that, what we call that cognitive reserve. So you can't just do a Sudoku one day and not again. You've got to build a lifestyle that keeps your mind engaged. Avoiding smoking is really important, because cigarette smoking is associated with a lower brain volume in people with MS and with higher relapse rates and increased disability progression and more cognitive problems and reduced survival compared with not smoking. So smoking in MS is very strongly contraindicated. Watching how much you drink, because obviously unsafe levels of alcohol have a very negative effect and higher mortality for people who have MS. And then also just making sure you're looking after your whole health. So if you do have high blood pressure or diabetes, etc., just making sure that you're looking after any other what we call comorbidities that are happening, so that they continue to be well managed. So what we're looking at is encouraging, or some top tips for you to live well with MS can include making sure that you're looking after the basics, which is very much what we've just covered in the previous slide. So looking at those core elements of making sure you get good sleep as best you can, making sure you've got a great diet, making sure you're drinking enough water, limiting caffeine and alcohol, making sure you're getting that exercise, that you're getting outside and enjoying the sunshine in a healthy fashion so it doesn't affect your skin health, looking after your mental health and looking at what coping strategies you're using and do you need some extra help in that area, looking at what fun things you make sure you keep in your life that bring you joy, that are important to you, that you can really savor. So looking after those core basics is obviously really, really important. As we mentioned before, managing the medical side of things, so looking after any other conditions you have. But once you get a diagnosis of MS, it's important that you're able to manage the medical side of things. So some tips like writing things down, keeping a running list of questions for your neurologist, for example. And we've got a fantastic podcast with Associate Professor Jeanette Lechner-Scott, and it's all the questions you ever wanted to ask your neurologist and either asked and forgot or forgot to ask in the first place. And I'd really recommend that podcast for people as well. Keep all your medical paperwork in one spot. Really important, be honest with your medical team. So some of the MS symptoms can be embarrassing and difficult to talk about. Cognitive issues can be difficult for people to approach sometimes. Continence, bladder and bowel continence issues can be a difficult conversation. Sexual dysfunction can be hard to bring up, but you need to be as honest as you can. And again, if you listen to some of our podcasts, it will help you to understand what's happening and empower you to know what you can do to help yourself in some of those areas. And that can be a good starting point for you as well. I think it's also really important when you're managing the medical side of things to get some real clear communication with your neurologist or your MS clinic about what should I contact you about? How do I contact you? What's the number? Who do I speak to? How long will it take for you to get back to me? If I think I'm having a relapse, who do I call? What kind of things would you prefer me to go to the GP about? And what type of things should I come straight to you about? And again, a lot of this is covered in our podcast. If you're unreachable, is there another person or service that I should go to? If I think I have a new symptom, how long should I wait before contacting you? So they're really important questions to ask your neurologist. Managing your social environment. So that's, the people you've got around you, they're supportive, they understand, and, considering how you spend your time, what you say yes to and what you say no to. And certainly for me, when I run wellness programs for people who've got MS, one of the things that just about everybody or in every session, somebody will say one of the key things they've learned since having MS, and often because of the fatigue side, is learning to say no. The flip side to that as well is also learning to ask and to accept help. And that's not always that easy, but certainly a skill and an art that can help. And prioritizing, when you've got limited energy, determining what is important for you to do, what you can delegate, what you can ditch, what you're no longer going to do, and making sure that with the limited energy you have available, you're still doing those great things that you love to do as best you can. And you're not just doing the chores that have to be done, but that there is energy set aside to do the beautiful things that you love doing. There's lots of helpful resources on our website, ms.org.au. Here's some that might be particularly useful. Dr. Sally Shaw, who's a psychologist, she's got a great webinar here about taking charge and becoming your CEO. There's the Brain Health Guide for you here. We've got the What's Causing My Symptoms tool, and I'll pop on to a few more resources that we provide here at MS as well. I like this saying. It was provided to me by a person with MS in one of our wellness days. It said, you can't control the wind, but you can adjust your sails. So we have a wonderful resource with MS Connect, which is 1-800-042-138, or that's our email here. And you can call MS Connect and speak to an MS nurse advisor, a social worker, an MS expert. And then it's also the gateway to all of our services. So if you're wanting some support to stay in employment, or you're wanting some help to look for a job, or you're wanting some advice about whether to tell your employer or not and how to do that, if you're wanting to link onto some of our education or be in our database to ensure you receive information, if you want to connect in with peers, somebody else who's in the same situation as you and you'd like to talk with them, there's a plethora of services that we've got to help support you. So here are some of the reasons why you might contact MS Connect. As I mentioned, we've got a wonderful peer support team. They do face-to-face support groups, telegroups, Facebook groups, and you can find a group that really relates to the situation that you're in. We've got an online tool called Get Your Act Together to help you manage common symptoms of MS. I've spoken about our employment support service. We are an NDIS provider and we provide different services in different locations. We've got some great podcasts on a range of symptoms, and we've got Inspiring Life series of podcasts as well. And we're just launching a podcast series on relapses. We've also got video podcasts, so little short snippets of podcasts on particular symptoms. So thank you so much for your time today. Here's the important communication and contact information for us. And I will hand back to Annetta, and just also to ask if there are any questions. I'm very happy to stay online and answer those questions for you. So thanks very much for listening. Thanks, Annetta, for inviting us.
Thank you so much, Nicola. I do have a question for you. Now, based on your experience and expertise, will everyone develop severe symptoms?
No.
No.
For some people, they hardly notice they've got MS, Annetta, and for other people, yes, the symptoms do become severe.
Right. Okay. And
it's very unpredictable and absolutely different for everybody.
Okay, lovely. Also, another question. You mentioned that it's very important to exercise physically. Do the strengthening of the muscles improve the mental outlook of the patient?
Well, I think exercise helps to improve mood for all of us. So and also a particular type of exercise, the high intensity interval training exercise, has been shown to actually increase brain mass. So given we're having that atrophy occurring, then that particular type of exercise really helps with the cognitive function. And as I'm saying this, it makes me think I must get out and do some exercise today. It's always a reminder, isn't it? And obviously exercise is going to strengthen muscles, so that can help with balance and maintaining function. So obviously for people who have fatigue, it can feel like exercising is beyond possible, but so important that we do exercise. So you do what's appropriate for you, and you stop before you're feeling overly fatigued. But we know that even though we're tired, if we do some exercise, it creates more energy. So
wonderful.
really important.
Before you go away, I do have another question. What about alternative therapies, such as special diets or vitamins or acupuncture?
Yeah, I don't know of any particular studies with acupuncture and MS, but you know, there's definitely been studies with acupuncture and pain management, and given that pain is such a significant part of MS for a lot of people, I would encourage exploring that with a qualified and registered acupuncturist and reputable acupuncturist. Acupuncture can help with sleep, and I'm sure it can help with a lot of other things. It's not my area of expertise. Diet and special diets with MS, really, really interesting. MSRA is currently funding quite a bit of diet research, including some work with Dr. Lucinda Black and her team at Curtin University, and there's some really interesting work coming out of there. So we've got a particular podcast on Eat Well, Live Well. We've got a webinar on by Lucinda on her particular areas of research. So we've got a whole area on Eat Well, Live Well. We've got a webinar on by Lucinda on her particular areas of research. So we've got a whole area on our website on what foods you're encouraged to eat. So a general healthy diet in line with the Australian dietary guidelines is recommended, but then more omega-3s, particularly flaxseed oil, is where there might be some interesting work. But a general healthy Australian dietary guideline diet is really important. And then those essential fatty acids seem to be particularly important too. But some really interesting work in gut dysbiosis, so getting healthy gut bacteria is also showing to be encouraging. And again, we've got a podcast and a webinar with the Deacon food and mood area. So if you're interested in that area, there's lots of really good evidence-based information. In terms of a specific MS diet, they all ask you to eat more nutrient-dense food, and then they have their own peculiarities or specific recommendations outside of that. There hasn't yet been a large study of an intervention-based diet that we could really hang our hat on. And again, there's more information about that on our website.
Wonderful. Thank you so much, Nicola. Now we haven't got any other questions. I'm not sure if the participants have any questions.
Yeah, just having a look. I think there's one here from Teresa. And she said, what should I do when my neurologist dismisses my symptoms? I feel I get fobbed off by my medical team and I don't know where to turn. Teresa, I hope you feel empowered to advocate for yourself. I would encourage that you call the MS Connect line and have a conversation with one of our nurses. And you should definitely feel like your symptoms are being properly listened to and that you're being understood and supported. So please give us a call, and you need to feel empowered to advocate for yourself for sure and listen to. So you might not be with the right people. So Annetta, I might hand back to you to finish off the webinar. Thank you so much, everybody, for tuning in. Really appreciate it. And please do get in touch with us and we can provide any extra support for you.
Thank you for being here with us, Nicola, and sharing your wealth of experience and expertise on multiple sclerosis. And a big thank you to everyone who attended today. And we hope to see you in one of our health information sessions in the near future. Thank you, everyone.